This is our disclosure. This is an off-label use for the IRE. The electroporation is a non-thermal technique where the targeted delivery of the electrical pulses render the cell membrane permeable. This could be either temporary or permanent. This image summarizes the electroporation phenomena. This is the cell membrane before, during, and after pulsing. You can see that the cell membrane goes back to its original state after the pulsing. This is what happens with the reversible electroporation. In case of irreversible electroporation, the cell membrane pores become permanent, and there is loss of the cell homeostatic mechanism inducing apoptosis. The use of the thermal ablation in vertebral body has been limited because of the potential damage for the critical neural structures. The aim of our study was to evaluate the effects of the IRE ablation on the lumbar vertebra in pigs. We did 16 CT-guided ablations in the lumbar vertebrae of 8 pigs, either in transpedicular location or posterior cortex using a bipolar probe. We did MRI imaging just before euthanasia at 2 and 7 days post-ablation. We measured the maximum length and the width of the ablation on T2 and the post-contrast series, and we compared those measurements to the histopathological measurements. The clinical, the imaging, and the histopathological data were analyzed. The technical success rate for the probe placement and ablation was 100%. The mean distance from the probe and the posterior wall in the posterior cortex group was 2.93, and between the probe and the exiting nerve root was 7.87. None of the animals had neurological deficits or MRI findings of focal myelopathy or radiculopathy. This is an example of the posterior cortex. This is an example of the transpedicular group, and this sagittal image shows the proximity between the probe and the neural foramen. It's about 5 millimeters, and those are the corresponding gross and histopathological sections. And on the T2 images, you can see signal change involving the muscles adjacent to the vertebral body, and this showed post-contrast enhancement on the post-contrast series. This is an example of the posterior cortex group. The probe was about 2 millimeters apart from the anterior wall of the spinal canal. You can see also the changes extend beyond the vertebral body into the opposite muscles, and this area showed enhancement on the post-contrast series, and those are the corresponding gross and histological sections. This table summarizes the average ablation measurements on the gross histopathology T2 and T1 post-contrast studies. The absolute % difference of the ablation measurements between the MRI sequences and histopathological lesions